Hello everybody, my name is Medical101 and welcome to lesson 4 of Dentistry101 as a part of the Medical101 website, and today we are going to be going over dental specialties in an office. As always, you can choose to take notes, sit back, relax, and be sure to check out the disclaimer before we begin. So maybe I'll just give you guys a second maybe to get out a notebook or something, but as always it's optional and you can just choose to enjoy the lessons at your own pace, as fortunately these are on demand. Now, let's begin. So your local dentist team typically consists of the following: a general dentist, hygienist, one or more dental assistants, receptionists, and office managers. So there could be multiple general dentists depending on the clinic near your house and the size of it. So let me just take a note of these, that this is really important. General dentists, hygienists, dental assistants, receptionists, and office managers. Now, the general dentist. The general dentist is your primary dental care provider and perform a wide variety of procedures and functions. They help diagnose and treat dental issues and help patients develop better oral hygiene regimens. They help with gum care, root canals, fillings, crowns, veneers, bridges, and preventative care. And then the recommended checkup with the general dentist should occur every 6 months. So one thing that's important to know is that this is likely the easiest way of becoming a dentist, as it takes the shortest amount of time, being only 8 years of schooling. Everything else beyond that may take more years. So my image source is Frankfurt Dental Care, Philadelphia, Pennsylvania. Now, hygienists. So dental hygienists are trained in oral hygiene procedures which they may undertake in the dental office as directed by the dentist, including scaling and polishing teeth, providing fluoride treatments, and providing oral hygiene instructions and counseling. My source for the image is your Drew Metals, InspiraAdvantage.com. So we know what the hygienists do. We typically, if you go for a cleanup, it won't be the dentist that does so, but the hygienist. The dentist maybe gives like its recommendations and maybe tells the hygienist what to do, as they do whatever is directed by the dentist. However, our cleanups and polishing, fluoride treatments, and all the things listed are done by the hygienist. And in this photo, you can obviously see a hygienist. Now, dental assistants. So dental assistants assist the dentist while this dentist is treating the patient. They may be directed by the dentist to carry out certain procedures on patients, including taking x-rays, placing rubber dams, taking impressions, and polishing teeth. So my citation for this image is the government of Alberta. And essentially they work alongside the dentist while the dentist is doing maybe some procedure, and they help maybe just do the other stuff that the dentist may not be able to do due to time constraints or maybe extremely busy. Now, management plus reception. So the office managers and receptionists are vital members of the dental team and are the face and smile of the office. They are responsible for scheduling patients, looking after website content, which can also include building a website and keeping a database, electronic billing, manage charts, month-end reports, and assist patients with dental insurance claim forms. Although these roles do not require specific education in dentistry, these members provide an essential part in the practice's ability to run efficiently and effectively. So basically, you can consider them like the lungs of the dental office, as without them it doesn't work. They're important. They are responsible for the database of scheduling patients, calling them, manage charts, month-end reports. Essentially, they are one of the most important parts, yet most overlooked parts of the dental office. Because let's say, for example, if you want to schedule a checkup with the dentist or the hygienist, you wouldn't call them, would you? You would call the management and reception, who would carry that to the hygienist and dentist due to their extreme busyness. Now, these are some of the salaries. So the dentist in the US, it's general dentist, its highest is 196,000 to lowest 123,000. The hygienist, its highest is 98,000, lowest around 61. The office manager is the highest around 67, lowest around 37,000. The billing specialist, the highest is 70,000 and lowest is 43,000. The receptionist, the highest is 49,000, the lowest is 25,000. Finally, the assistant's highest is 45,000 and lowest is 28,000. So as you can see, a lot of these roles are based on experience and level of difficulty of their work, yet all members are extremely vital parts of the office. And my image source is Panakia Financial. Now, the specialties. So in most countries that recognize specialties in dentistry, their specialist is limited to practice in the specialty and cannot carry out the practice of general dentistry. When the specialty is thus limited, the general dentist may refer patients and specialist places mainly on a referral basis. So today I'm going to be going over some of the main specialties that are recognized in Canada by the Commission of Dental Accreditation of Canada, CDAC, and these are some of the ones that they recognize. So firstly, orthodontics. These are the ones that put on your braces and maybe make your smile look nice. So maybe just take a minute to get your notes out. So their specialty is that is focused on the recognition, prevention, and treatment of misalignments and irregularities on the teeth, jaws, and facial profile. They're concerned with the supervision, guidance, and correction of the growing or mature dental facial structures and the diagnosis, prevention, and treatment. Patients can be children, teenagers, and seniors. And their orthodontic treatments provide a beautiful smile that brings teeth, lips, and jaws into proper alignment. Their improved teeth and jaw alignment provides better function and easier cleaning with long-lasting results. Orthodontists spend 2 to 3 years in an orthodontic residency program after graduating from dental school. So we just take a minute to get that down. Now, oral medicine and pathology. So it's the study of oral diseases, their causes, and their effect on the body. So they're the diagnosis, nature, and primarily non-surgical management of oral, maxillofacial, and temporal mandibular diseases and disorders. Oral medicine and pathology are two applied components of the specialty. A practitioner in this is a dental specialist who has successfully completed a form of advanced education program in oral medicine and in oral pathology for oral pathology. And a practitioner in oral medicine and pathology is a dental specialist who has completed formal advanced education programs in oral medicine and pathology. Now, dental public health. I can just take a sec to get your notes. So they essentially bring the government-sponsored oral health care to communities. The goal is to achieve optimal oral health among Americans through education, disease prevention, and disease promotion. They provide assistance and programs for individuals who don't have access to dental care. So my source for this is Colgate. So they are population-based dentistry, community-based disease prevention, health promotion is concerned with the diagnosis, prevention, and control of dental diseases, and the promotion of oral health through organized community efforts. They serve the community through research, health promotion, education, and group dental care programs. So though they are not too much in the clinic, they are also paid very well relative to other dentistries and jobs, having an average salary of $166,000 in Ontario. And my source for this is the iriri.com. Sorry if there's any mispronunciation. Now, maybe just take a minute to say your notes. Now, oral and maxillofacial radiology. This is the specialty of dentistry and discipline of radiology concerned with the production and interpretation of radiographic images, including CT and MRI scans that are used for the diagnosis and management of diseases, disorders, and conditions of the mouth, face, and jaws. So it's a minimum of 4 years of advanced training in anatomy, anesthesia, pain control, and surgical procedures. An oral and maxillofacial surgeon performs the following: patient's diagnosis, teeth extractions, slice, and tumor removal, biopsies, and emergency/reconstructive/implant surgeries. Now, periodontists. So they specialize in diseases of the tooth around the root of the tooth, and they deal with symptoms, probable causes, diagnosis, and treatments of periodontal diseases. So the prevention and treatment of disease and conditions of the supporting and surrounding tissue of the teeth. So they're dental specialists who successfully completed an accredited advanced education program in periodontics and currently hold such specialty designations from a provincial dental regulatory authority. And don't get that confused with pediatrician. They sound very similar, but it's easy to get confused when they're completely different. Which brings me to endodontics. So they diagnose and treat diseases of the pulp and periapical tissues. The diagnosis, root canals, and periapical surgery, morphology, physiology, and pathology of the dental pulp and periradicular tissues. They refer general dentists refer to an endodontic, and they send written instructions and radiographs to the endodontic. Now, prosthodontics. So the diagnosis, restoration, and maintenance of oral function, comfort, appearance, and health of the patient. The restoration of the natural teeth, and or the replacement of missing teeth, as well as replacing contiguous oral and maxillofacial tissues with artificial substitutes. So their role as the oral architect of the dental team means that they develop treatment plans and synchronized treatment sequences with dental medical specialties as well as with general dentists. The clinical expertise of the prosthodontist consists mainly of two components: diagnosis, treatment planning, and prevention, and then dental treatment with a wide repertoire of solutions including fillings, dentures, veneers, crowns, bridges, splints / night guards, implants, and cosmetic dentistry. Now, pediatric dental care. So don't get that confused with prosthodontics. But they provide dental care for children. They treat children from birth through the eruption of their second molar, and the restoration and maintaining the primary, mixed, and permanent dentition, as well as applying preventative measures for dental caries and periodontal disease. What I did mention is that mixed dentition means a mix of the primary and permanent dentition, while the permanent dentition is erupting before 32 teeth. So we see that in a lot of younger infants and children. So they have special training in child growth development and behavior management, and their primary focus on pediatric dental practice is preventative care. And then my image source is Bamboo Dental. No. The high salaries. So my source for this is prodentsearch.com. So I'm going to be just talking about the 7 highest paid dental salaries in the world. I apologize, the US. So firstly, the oral and maxillofacial surgeon, they earn between $267,000 and $440,000. Next, and their highest paid states are Massachusetts, Washington, and Colorado. And then it takes 4 years of undergrad study and 4 to 6 years of residency training, so it takes a lot of time. Second, the dental anesthesiologist, which actually will go on right now, the bonus of dental anesthesiology. So they're responsible for giving and monitoring anesthesia during a dental procedure. So because many people fear the dental fear, there's a lot of the fears around pain and trauma. So dental anesthesiologists give general anesthesia, which which is responsible for like reducing pain, and it also takes many years to do this: 4 years of undergrad, 4 years of dental school, and 3 years of residency. Then the orthodontist, which is $175,000 to $357,000. So you need 4 years of undergrad, 4 years of dental school, and 2 to 3 years of residency. And you also need state license in the USA. So it is a lot of work as well. And the prosthodontist also takes a minimum of 11 years. 4 years of undergrad, 4 years of dentistry school, and 3 years of residency. So you can see a lot of these specialties, they take more time as you progress higher and higher. But it's all worth it in the end for the good life and the good salaries. And then the endodontics, which have an average salary of $162,000 to $286,000. So they take around 12 years, as it takes a minimum of 4 years of undergrad, 4 years of dental school, a minimum of 2 years residency. So my apologies, 10 years. And then you also need state license. And then pediatrics, who for the children, $193,000 to $294,000 is the range average. And these are just averages, by the way. These are top salaries. Truthfully, if you own your own clinic, the sky's the limit. So for them, it takes 4 years of undergrad, 4 years of dental school, and 2 years of residency. And you also need state license. And finally, the periodontist, which makes $119,000 to $259,000. So it takes 4 years of undergrad, 4 years of dental school, and 2 years of residency. However, it's important that you choose your dental specialty based on what type of education you're willing to invest in, your personal interests, and if what you really can imagine yourself doing for the rest of your life. Because these are, even though these all revolve around dentistry, they are much more different from each other. And then, if for the people living in the U.S., according to the same statistic, Oregon, Alaska, Washington, Massachusetts, and North Dakota have the highest paid states for dental specialists. So if you are in the U.S., maybe you could think about further education there, and maybe pursuing a dentistry there. Now, I just discussed the dental anesthesiology. Now, in conclusion, that was lesson number 4 of dental specialties in an office. There are still a little bit more lessons to go. As always, if you enjoyed, please be sure to check out other lessons of Medical 101. Please be sure to check out the disclaimer, which is very important. I hope you guys enjoyed, and yeah, have a great day.